All right, good evening, everyone. I want to call the Board of Health meeting to order for this August the 4th, 2022. I'd like to welcome those who are in our audience in attendance this evening, as well as those who are joining us by TV. And again, welcome. And we have a few on Zoom too, but we appreciate each one being here this evening. Is anybody signed up for our public comment? So no one signed up, which will lead us to our invocation. And I'm going to ask Dr. Davis if he would lead us in our invocation, and then we'll do our Pledge of Allegiance. And I'll ask the Honorable Wayne Rash to lead us in that Pledge of Allegiance. So,
bow your heads with me, please. Almighty God, we thank you for the blessings and the guidance through this pandemic. We thank you for this dedicated health department staff who has worked tirelessly to provide good health prevention for all of our citizens here in the county. Guide us and direct us in this meeting. Help us to be better citizens and better servants of you. In Jesus' name we pray. Amen.
Amen. Face the flag.
Attention, salute, pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, thank you, everyone. That brings us to our announcements and our Health Director, Mr. Anna Martin.
All right, so I do have a few announcements. One is regarding our reaccreditation. We just received our 90-day notice, so by the end of the year, we'll probably see a few of the site visitors come our way, so we're getting everything together and sending that evidence in. Our community health assessment is underway. We're planning to collect the surveys by the end of August and then gathering that data and moving forward. So it's already out there. It's been out there since the 1st of July. We do have a few events coming up. We have a breastfeeding event tomorrow morning at Mulberry Recreation from 9 to 11. And then we have a back-to-school immunization event on August the 15th from 3 to 6 at the health department. I did want to mention that, and I know Chad may go more in detail with this, but our COVID cases are increasing just a little at this time. I noticed whenever we're doing our data on Wednesdays, it was kind of stable to steady, but now it is rising on our end. I'm not for sure, you may go in depth, but I just want to let you guys know that we are keeping a close eye on that. Hospitalized is not that many, especially in ICU, but the cases in general. And then also I wanted to mention merit increases. This is something that the county has approved for our employees. And this is something that we've needed in a while, and I believe our employees are thankful for that. So I just wanted to let you guys know and thank the commission for approving this. Basically, they get a merit 1, doing their job, merit 2, going above and beyond, and doing different things like that.
Okay, thank you. So with that, we'll move to approve our agenda. And I'll ask if there's any amendments to the agenda this evening.
There's 3 on Article 7, an oath of office. Dr. Wisnet has already completed that, so we will not be doing that tonight. 10, the final update for the budget has not been completed yet by the county, so what I might do instead of wait till our next meeting is send it through email so you have a more idea, and then we'll go more in depth with our meeting. And then Article 11, B, WIC services. We're not going to have a presentation tonight on that.
All right. So removing those from our agenda, do I hear a motion that we adopt the agenda this evening?
Move to approve. Second.
And a second. Thank you, gentlemen. And all those in favor signify by saying aye.
Aye.
Any opposed? And that motion carries unanimously. Our first item on that agenda is our election of officers for the upcoming year. And so do I need to turn this over to you?
Yes.
Our health director will handle this election of officers. So you are now in charge, Miss Martin.
Thank you. All right. I want to open the floor to Chair. Do we have any nominations for Chair of the Board of Health?
I would nominate the Honorable Randy Church, County Commissioner, to continue his fine service as Chair of the Board of Health.
Do we have any other nominations for Chair of the Board of Health? Hearing any? All those in favor say aye.
Aye.
Opposed, same sign. Congratulations.
Well, thank you.
Yep.
I can finally win something. All right. So with that, we will open the floor for nominations for Vice Chair. So do I hear anybody would like to make that nomination of the Honorable Wayne Rash?
I'll make that motion.
Do we have any other nominations besides Wayne Rash? Hearing none, I'll close that and assume we can receive that nomination by acclamation, but I will ask for an affirmed vote. All in favor saying aye? Aye. Any opposed? And that motion carries. He was, you just don't know how close. All right, so thank you, everyone. And again, we appreciate everyone who serves on this board. It's been some trying times for the past 2-3 years with our board and the membership, and you folks have done well in maintaining, and certainly want to brag on our staff as well and all that we've been through with this pandemic. And hopefully we're coming out the other side of that now, but we certainly feel very well in hands with all the things that's going on. So I appreciate everyone's efforts in that, and everyone that's had a part in leadership, and down to those that have actually done a lot of work in vaccinations and testing and all of that. So it doesn't go unnoticed on staff, and we certainly appreciate it. Next would be our approval of minutes for the May 5th meeting. I hope you've had a chance to review those, and if so, do I hear a motion that we approve those minutes?
I'll move to approve.
I'll second.
And a second. So thank you. All in favor signify by saying aye.
Aye.
Any opposed? And that motion carries unanimously as well. And that brings us to item 10, financial reports, and a 22-23 update of our financials.
All right, so the month ending in May, 92% of the budget has elapsed. The total budget, we've used, the expenditures is 67%. The revenue that received and brought in is 67%, and the county revenue is 65%. So with this, talking with our finance department, we're still waiting to close the month out. So we're looking in still pretty wonderful shape with this.
All right. And anything for upcoming, or we're just in good shape moving forward?
Moving forward.
All right. So that doesn't require any action. And next, did we have any budget amendments or revisions?
Not this time.
Nothing. So very well. That brings us to item 11 and our patient portal update. Miss Libby Clark is going to come out of the shadows over there.
We have started a patient portal at the health department. Shanda Watson is our portal administrator. She's doing a great job. We currently, as of this afternoon, have 322 patients that have signed up within the last, probably since May.
Yep.
And so it's a big deal. They have instant access to all the letters. If we put a letter in the computer and we print it out and mail it, they get it like that. Lab results, they get them as soon as somebody in the clinic signs off and acknowledges them, and makes notes about whether they need to follow up on them or not. There will be online payments coming soon to where people can make payments at night and stuff. Would be a lot more convenient for people. And there is one thing that the state has requested, that when a child turns 13, we make them get their own portal. And you can sign up like all your kids to be under your portal. But because of the nature of the health departments and the confidentiality services that we provide, they would like for the child to come out of that at 13, and if the child chooses to give anybody their password and all that, they can. But we're protected that way so that we're not giving away personal information that the child might not want anybody to know. But we're looking forward to seeing what this leads to. We're not going to, they can request an appointment. They can't make an appointment online because there's a lot of stuff that goes into that we need to talk to the patient to find out things.
Right.
But so far, everybody seems to really like it, and we're
Good.
excited about it. Thank you.
Very well. Thank you. Next is our communicable disease update. Dr. Picton, and is Chad coming up too? You gonna go first? I was warned that this might take a little bit.
I'm always fast. There would be a quiz at the end, though. So
I don't know, Dr.
Take a
Picton.
something else to talk about besides COVID. Everybody is excited.
Another virus.
Yay! Woo! Monkey Pox.
Yes.
So monkey pox is a viral zoonosis, which means it mainly circulates in an animal reservoir, and humans are basically just an incidental host. The symptoms are similar to smallpox. However, it's clinically less severe and much less contagious than smallpox was. The name monkeypox really just comes from where it was discovered in a Danish laboratory in 1958. Some monkeys were there and they developed some pox-like lesions, and they discovered the virus and said, this is monkeypox. However, the animal reservoir is unknown, and humans and monkeys are basically just a secondary host. The first case in humans was noted in 1970 in the Democratic Republic of Congo. It's mainly just stayed in the Central to West African countries, with only several hundred cases since 1970. What's that, 50 years? Some theorize, well, it's just a very low contagious disease. Others theorize, well, perhaps our smallpox vaccination immunity is helping. Who in here has had their smallpox vaccination? A lot of people are willing to admit their age.
I had it many years ago.
The last smallpox vaccine given in the United States was in 1972. And so probably that immunity may be waning and no one's getting vaccinated anymore. So perhaps that's why it's just now starting to become more of a viral illness than what we've seen in the past. Uh-oh. Help.
It's not
Eric.
advancing.
Virology, everybody's favorite subject. Monkeypox belongs to the Orthopox genus, which is similar to smallpox and cowpox, not to be confused with chickenpox, which is a herpes viral family. It's transmitted from person to person, similar to smallpox, with fluid from the lesions. If you have a lot of fluid lesions in your mouth, you can cough it out, and if you contaminate beddings with your secretions, it can also be transmitted that way. The incubation period is 1 to 2 weeks. The good news is mortality has been estimated to be between 1 and 10%, very low. And depending on what strain is circulating, and the current strain has a very low mortality rate, probably less than 1%. Like I said, monkeypox is transmitted through close personal contact, sometimes skin to skin. If you come in contact with the rash, the scabs, fluid coming out of the lesion, and again, touching fabrics. And this is like someone just sat there or brushed by. It's got to be somewhat significantly soiled by the virus to transmit it. As we mentioned before, respiratory secretions can also spread it, but this is much less common, especially with monkeypox. It was more common with smallpox. Like any viral illness, you start off with flu-like symptoms: fever, headaches, muscle aches, swollen lymph nodes, chills, exhaustion. And then after a viral illness, then the rash starts to develop, usually 1 to 4 days afterwards, and it goes through very specific stages. If someone just has a bump, most likely that's not monkeypox. You don't have to come in for a culture. It goes through a very specific transition of stages, which we'll go over here in just a little bit. As we said before, it usually lasts between 1 to 2 to 3 weeks from exposure. And the rash, once the fevers and the other flu-like symptoms starts, the rash begins in 1 to 4 days. It oftentimes starts on the head and then moves to other part. The current monkeypox outbreak seems to be more of a genital spread lesion, and it tends to be more in the genital area. And again, as we mentioned before, mortality is low, and the current strain has less than 1% mortality. So the rash begins 1 to 3 days after the appearance of fever. In the past, it's developed on the face and then spread to other body parts. Currently, it seems to be located mainly on the genital areas. And it goes through a very specific progression from a flat bump to a pus-filled bump or a pustule to a papule to a raised bump, then a watery-filled vesicle, then a pus-filled vesicle, then the pus breaks open, scabs forms, and it heals. It takes about 2 to 4 weeks for the rash to clear. So all bumps aren't monkeypox. Lesions are well circumscribed. It means they're very well defined. They have very sharp borders. They're deep-seated, and they sometimes develop a little umbilication in the middle. Lesions are relatively the same size and the same stage in development on that specific site. So if it's on the face, that's usually one site. The hands can be in a different stage, but usually all the lesions on the same body site are in the same stage. Fever always comes before rash. Most people have some swollen lymph nodes. Usually it starts from the face and then spreads outward. Again, this isn't always true with the current outbreak. Lesions on palms and soles. There's very few rashes that occur on your palms and soles. I think syphilis is one that comes to mind, Rocky Mountain spotted fever, and apparently monkeypox. And the lesions are reported as painful and then become itchy. So this just shows the progression of a water-filled vesicle to a pus-filled bump to an umbilicated pus-filled bump. The pus bump ruptures, it scabs over, and then it heals. So all bumps are not monkeypox. This one shows all of them in the same stage of growth on the face. You can see how sharp the lesion is, very specific. And there's some on the palms and soles. And just more pictures of the monkeypox rash. So monkeypox has visited the United States before. In 2003, apparently 800 animals were shipped from Ghana to an animal facility in Texas. And unfortunately, they put them close to the prairie dog section. And then these prairie dogs were sold as pets. And from April to June of 2000, 71 cases of monkeypox were reported from contact to the prairie dogs. All people infected with monkeypox became ill after having contact with an infected prairie dog, and there were no instances of monkeypox infections that were attributed exclusively to person-to-person contact. So what's the take-home message from this?
It's become more virulent, or it's more transmissible.
People hug their prairie dogs a whole lot more than they hug their own family members. So in 2021, apparently a citizen from Nigeria traveled to the United States, again to Texas apparently. Apparently had 2 commercial flights and came in contact with 200 people. 21 days passed and no additional cases were identified. A similar occurrence happened in Maryland with no other members identified. And what's the take-home message from this?
Don't travel to Nigeria.
Don't go to Texas.
Airports.
Don't travel from Nigeria to Texas. Casual contact is very difficult to transmit monkeypox. So basically, I started this presentation back in June, and this is what the situation. Apparently, they had identified a case in May 18th of 2022 on a person that returned from Canada that did test positive for monkeypox. They had confirmed 9 other cases in 7 states, but all were suspected and all were being followed. They were known contacts. And the CDC, in addition, was tracking multiple clusters of monkeypox in Europe at this time. That seemed to come from an original source, too. So that was in June. This was like 2 days ago. The total confirmed cases were 5,811. Again, the bigger your population, the more numbers you're going to probably have. New York had 1,390, California 827, Illinois 520. The first case was identified in North Carolina in June 23rd of 2022. Essentially, all cases have been identified in men who have sex with men, consistent with findings of all the other jurisdictions. The total number of cases is 60, which ranks about 15th in the United States. I think we rank 9th in population, so we're a little bit behind on our cases. So there are some preventions. There's 2 ways to prevent it. One's called just the primary prevention, where you get a vaccine to prevent it. The other one is called post-exposure prophylaxis. And there are 2 vaccines that can be used. I'm not going to go into great detail. Both of these are in the strategic national stockpile mainly for smallpox prevention. The first one, I can't even pronounce it. It's FDA approved for smallpox and monkeypox. It's a 2-dose vaccine, unfortunately, given 4 weeks apart. And the other one is the old standby, the vaccinia, where you put the droplet on the bifurcated needle and stick it in your arm, called scarification. That's the old way they used to give the smallpox vaccine. So for post-exposure prophylaxis, you should give it within 4 days of exposure. You can give it up to 14 days, but it won't prevent illness, it just prevents symptoms. So who is eligible for the monkeypox vaccine? People who have been in close physical contact with someone who was diagnosed with monkeypox in the prior 14 days. Number 2, men who have sex with men or transgender individuals who report any of the following in the last 90 days: multiple anonymous sex partners, being diagnosed with sexually transmitted disease, or receiving HIV pre-exposure prophylaxis, and maybe some certain healthcare people that are dealing mainly with the cultures and things. So the problem is the vaccine is very limited. There's only 9 health departments in North Carolina that actually even have access to the vaccine, and Caldwell County Health Department is not one of them. It's the 9 populated cities, the biggest cities in North Carolina that currently have the vaccine. Monkeypox testing is available. It's the old standby polymerase chain reaction PCR testing for viral DNA. Who should be tested? Anyone with skin lesions and known contacts to monkeypox. Anyone with skin lesions are in those high-risk categories, men who have sex with men, multiple exposures, or anyone who have symptoms and rash consistent with monkeypox in contact to someone with a similar rash. Not just a bump, but symptoms and a rash that looks like monkeypox. There are some treatments as well. Again, this is mainly for smallpox, but they do use them for monkeypox as well. There's no FDA-approved monkeypox treatment. The fact is most people don't need monkeypox treatment. Only those that are immunocompromised, maybe have lesions in the eye or in the mouth or in the rectum or something like that. And there is immunoglobulin as well, similar to the monoclonals that they use for COVID. There is immunoglobulin you can give for monkeypox, which is smallpox specific, but it seems to work. And that's all.
Very
Thank you.
well. Thank you, Dr. Tickle.
Have we had any cases in the county?
No.
How about surrounding counties?
Not that I know of. I think half the cases, I think the last I heard it was 60, and half of them were in Mecklenburg County. But no, I've not seen any in the surrounding counties.
Right.
No.
Mr. Barr?
So like Mr. Randy Church, I had hoped we would be moving past this by now, but I'll be giving a COVID update for you. So as Anna had said before, our COVID cases have been on a steady rise in our community since May of 2022, and BA4 and BA5 have now become the predominant variants in the U.S. and in North Carolina. That replaced BA2. The community levels for all counties in North Carolina are either measured as like low, medium, or high. And these levels are determined by three indicating factors, and that's the number of new cases per 100,000 people in the last 7 days, the number of COVID hospital admissions, and the number of available hospital beds. So that's what gives us our rating or our measure of low, medium, or high. And these community levels are in place to help guide schools, correctional facilities, congregate living facilities, in their practices to protect those people who are most vulnerable or most at risk. Now, Caldwell County has remained in the high category, I think, since like early June. Of course, one metric cannot provide us with all the surveillance data in order to able to report current trends. But one that I found that was interesting, I've mentioned it before to you, is wastewater monitoring. And a lot of people, when I mention wastewater monitoring, are like, what is that? So I wanted to go over that briefly with you. So people with COVID-19 or an active infection of COVID-19 shed viral particles in their stool. Now, in wastewater, the particles are no longer infectious, but they can still be measured. So testing wastewater for the viral particles allows us to track COVID-19 trends among people who used wastewater. Data from these sites serve as like supplemental metrics to help us to determine community levels. Now, our levels were really, really high in January and February, and like I said, they have decreased recently. We are seeing some mild increases through the months of May, June, and July, and we're hoping that we've seen our peak in late the third and fourth week of July, and we're now starting to decline again. So wastewater monitoring provides our community-wide sample to help track trends and levels of the virus, and it can sometimes serve as an early warning or increase in COVID-19 communities and provides information that helps communities to intervene or act more quickly to help slow the spread of COVID-19. So our newly diagnosed COVID cases in Caldwell County, they continue to peak and decline. We saw, what we see usually in Caldwell is that we peak a couple weeks later than the large cities around us peak. This is usually followed by an increase in hospitalizations, but that's usually 1 to 2 weeks after we see our peaks. And then, of course, that declines at the same rate. Fortunately, we are not seeing an increase in deaths. So that's the good news with this. We continue to monitor and report COVID outbreaks in congregate living facilities. And we currently have 4 long-term care facilities, our detention center, and a group home for developmentally disabled adults in outbreaks right now. So in June, our criteria for reporting and discontinuing outbreaks changed. So they've changed it from a 28-day period, 2 individuals in a 28-day period in a facility. That's what it takes to declare an outbreak in a facility, and that's been decreased to 14 days now. And then we're able to close out investigations of outbreaks if they've had no further exposure in the facility after 14 days, and that's been decreased from 28 days as well. So we hope in Caldwell to continue to see our numbers decrease. As you know, COVID takes kind of a back step back from Monkey Pox and what's kind of on everybody's mind right now. We encourage vaccines. We continue to give vaccines at the health department. We have a lot of people that's coming in for boosters, and So we're really glad to see that. So are there any questions?
Jim, what's the, I'm sorry,
No, go ahead.
what's the current guidance on second booster shots? I know that for a while it was just certain age groups or
Yeah,
is that
so-
still the case, or is that, where
That
is
is
that
still
at?
the case,
Okay.
yeah. I know that they have lowered the ages now, and they, continue to encourage those boosters when you're able to receive it. But there are certain guidelines and criteria. I don't have that in front of me right now, but, yeah.
Chad, I don't mean to throw you a curveball or anything, but you opened the door when you said wastewater surveillance. And I just saw that there was a case of polio in New York, and there was a wastewater surveillance positive test there. Do we test for polio, or what
So-
all viruses do we test for with the
So
wastewater
I don't think
surveillance?
that North Carolina Department of Health and Human Services, see, they partnered with UNC School of Medicine, and they come up with this, and they continue to use information, data to help collect or for surveillance purposes. But I don't know of any other viruses or illnesses or diseases that they are monitoring for in wastewater here currently.
Okay,
All right, thank you.
thank you,
Thanks,
Chad.
Chad. Next, we have Lisa Lowe. Hello, Miss Lowe.
Yeah, mine'll be brief.
Okay.
I'm going to talk about the less popular communicable disease, and that's hepatitis. It is as prevalent, unfortunately, as some of the COVID and the monkey pox, but not as popular on the news and the media and everything. But we do have outbreaks in North Carolina, especially with hepatitis A, and quite a few cases of hepatitis B and C in the counties and surrounding counties. So on May 23rd, I attended a hepatitis coalition work group, and in attendance was most of the counties surrounding us. And the purpose of this meeting was to come together and collaborate and coordinate care for patients in our local counties, especially for things like testing and treatment for hepatitis C. Local health departments are currently able to provide initial testing, but most are unable to provide treatment and medication for those. So we talked about those things and followed up with the surrounding counties and shared information with each other. Within Caldwell County, we have one provider who is willing to treat and assist with medication procurement if needed, and this even includes patients who are uninsured. So we're fortunate to have that here in Caldwell County for those folks. Counties are trying to come up with alternate ways of serving the communities. This includes ways to go out in the community and provide testing and vaccine in areas that are not within the confines of the brick and mortar health department buildings and clinics. One of the reasons identified that folks are not seeking care or treatment is transportation issues to these clinics. There is a new grant out there, and we're trying to work with that, and hopefully we've had some meetings within our health department and to how to utilize that grant and to identify and brainstorm ideas and how we can meet those needs and educate the citizens of Caldwell County. So we have several things planned geared towards hepatitis prevention and education, and these include banners, handouts, media updates, and we're planning to educate and give hepatitis vaccines to those who qualify at an upcoming Oakville Health Fair on August 12th. So we're going to go out and try to meet those people out where they are, and hopefully we'll be real well received with that and give them some education so how they can protect themselves. We're also working with other community partners to plan more ways to prevent hepatitis, so look for that upcoming. Okay. Any questions? All right. Thank you.
Thank you. Discussion of health director's knowledge, skills, and abilities. What do I need to discuss? Oh, we did do your evaluation.
Do you have the bright light?
Yeah, Wayne and I met with Anna and did her annual evaluation, and upon those that we received in the mail, as well as our personal evaluation, we gave Anna high marks across the board in all aspects, and so she continues to do a great job in leading our health department, and so we felt that we would recommend her for continued employment. No. We like to give Anna a hard time, but she's done well, and certainly appreciate her leadership, and I know her staff does as well. So we are very fortunate to have you, and don't take that lightly either. I can rest easy at night knowing that Dr. Picton is getting things identified, and you're handling them from your end. How's that? All right, does anybody else have anything they'd like to say this evening? Quiet crowd.
Just appreciate everything that the staff does. Thank you guys for the hard work and the good job on everything. And yes, Anna's doing a great job, but the department as a whole is doing a great job too. And so thank you guys for that.
We couldn't do it without them, so, and they know that. But I do want to say a shout out to Chad and Lisa and Dr. Picton with the CD stuff, because we've had a rough few years.
Yeah.
And I feel like Chad kind of got, welcome to Caldwell County Health Department, here's COVID-19, and that's what happened. And so now Monkey Pox, hepatitis, everything going on, but it takes the entire team, the entire clinic and the health department. So thank you guys for everything you've done.
Great teamwork.
Yes. All right. If there's nothing else, I will entertain a motion to adjourn.
Motion we adjourn.
Second.
And a second. All in favor say aye.
Aye.
Thank you, and this meeting is now adjourned. Thank you, everyone.